Hello everyone, today I am presenting a case of a 48-year-old female named Sandra Mitchell with the complaint of knee pain. For the subjective data, SM or Sandra Mitchell is a 48 years old Cajun female, date of birth 12/24/1976. She arrived to the clinic by herself. She is a reliable historian. For history and physical, SM, a 48-year-old Cajun woman, visited to the clinic for the complaint of knee pain that started after engaging this week in a yard. Patient mentioned it was a nice day out. She wanted to do clean up some yards. That's why she was out in the yard for cleaning. She was out there for a couple of days for planting the flowers and cleaning the yard, and then she experienced a pain in her knee yesterday. The pain emerges 15 to 20 minutes after work without any apparent of swelling or injury marks. Notably, there is no mention of a certain sharp pain immediately following the lifting or a moment of the flower pot. She described her pain as a constant pain and a hindering moment. She also mentioned it. She feels little better after resting and taking over-the-counter ibuprofen, which will work for like 30 to 40 minutes. And it is aggravated by walking, exercising, standing, or doing the yard work like bending. For the past medical history, she does have a past medical history of diabetes and hypertension. For the past surgical history, no mention surgical, no known any past surgical history. She is up to date with all the vaccination, including the COVID and flu for this year. For the allergy, no known allergy. For the medication, taking ibuprofen 400 mg every 8 hours as needed for the knee pain. For the family history, there is no related family history regarding the musculoskeletal system. Both her maternal and paternal grandparents passed away. Her mom has a history of diabetes and hypertension. Her dad has a history of gout. And siblings, she does not have any siblings, so she does. And for the social history, she is a non-smoker. She does not drink any alcohol. She drinks 1 coffee a day. She does not do any recreational drug use, no vaping. For a marital history, she is married and has a son. She is living with the son and her husband in a home. Has a safety rails on the stairs. She wears seat belts. No other safety concerns. She feels safe at the home. For the exercise and diet, she exercises 3 times a week. She goes to the gym and does her cardio for 1 hour 3 times. And then for sleep, she is sleeping 8 to 9 hours a day and take couple naps on her day off. And she is for the occupation, she is a school teacher, teaches in the school as an elementary, for the elementary level, or elementary school teacher. And for spiritual, she is a Catholic and believes in God. For review system, for the constitutional, she appears to be healthy, clean, denies any fever, unintentional weight gain or loss. For musculoskeletal, she reported of having a pain on her left knee while flexing and bending, and she is not being able to bear the weight on that leg. For neuro, no weakness, no numbness, no tingling. For cardio, denies any chest pain or palpitation. For respiratory, denies any shortness of breath or cough. For psychiatric, she reports of having mild anxiety related to the pain not going away. Other than that, no other mental health issues. During the physical examination, for the HENT, no rashes, redness, or visible swelling of the throat. Denies nasal congestion, denies hearing problem, does not wear any glasses. For the neck, denies stiffness, pain, or swallowing issues. For respiratory, no shortness of breath, no cough or wheezing. For cardiovascular, denies any chest pain or palpitation. For GI, denies any diarrhea, constipation. For urinary, denies dysuria or urgency and frequency. For peripheral, no noted edema on the extremities. For mental health issue, no depression, no mood swings or a stress other than a mild anxiety related to the knee pain. For endocrine, denies increased thirst and hair loss. She does does reported or denies any increased hair loss. For musculoskeletal, during the examination of the knee, no redness or swelling is observed on her left leg. There is a little bit of tenderness noted in her lateral and superior aspect of the knees. The patient exhibit a negative drawers or McMurray test. Pain reported on the knee during physical exam. No pain or discomfort is experienced with abduction, adduction. Ambulation is smooth without any favoring of left lower extremities. On her right leg, however, she was unable to ambulate or put a pressure on her left leg, or she reported of having pain. For the differential diagnosis, it can be a left lateral knee sprain experience related to a patient experiencing pain for 15 to 20 minutes after engaging in the activities involving moving plants in the backyard, and no noted immediate swelling or a visible injury. And the pain increased with weight bearing and flexibility, particularly on the lateral aspect of the knee. Sharp shooting pain reported. And for the another diagnosis can be anterior crucis ligament tear or the ligament tear with dicey pain increase during the walking. This can happen because the pain increases during walking or flexion, but no limping noted. ACL tears typically occurs with a sudden change in direction, often accompanied by audible pop and acute knee swelling. In this case, patient did not hear any popping sounds, or on physical examination, no noted swelling. Another diagnosis can be a meniscus tear. She does SM reported pain 15 to 20 minutes. No observed pain during flexion, and meniscus tears typically involve twisting the knee while the foot is planted. Clinical symptoms of meniscus tear include positive special test like McMurray's point test, but in this case he was negative for McMurray's test, so this is not her final diagnosis. So the final diagnosis is left lateral knee sprain. So she presented the indicated left lateral knee sprain attributed to her history of engaging in the activities leading to the injury. The absence of swelling or a sharp pain distinguishes this diagnosis from ACL injury or a meniscus tear. She exhibits the ability to flex and extend her leg without the strength loss, and there is no observed limping during the walking. Immediate swelling after the injury aligned with the final diagnosis of left lateral knee sprain. For the diagnostic, we can do the X-ray to find out if there is any. We can still do the X-ray to find out if there is any fracture or any ACL or meniscus tear. For the treatment, patient can still continue taking over-the-counter ibuprofen, 400 milligram every 6 hours as needed. Alternatively, they can also take the Tylenol 650 and with the maximum dose of 3 grams per day. For the patient education, she was educated on implementing the RICE, rest, ice, compression and elevation. Ice application can be done 15 to 20 minutes several times a day. For the pain reduction, the S-wrap can be removed. The S-wrap can be provided for the compression and can be removed at the night. For the follow-up is not needed at this point if the pain goes away within another 2 to 3 weeks. If not, or if there is any symptoms or worsening of symptoms noted, she can always call to the clinic or seek for the urgent care help. Thank you.